series is sponsored by the Autism Program, the Institute on Disability and Human Development, University of Illinois at Chicago, and the Illinois Leadership Education and Neurodevelopmental and Other Related Disabilities, or LEND program. Today's webinar topic is understanding the pathological demand avoidance profile of the autism spectrum. And we're very excited to have Diane Gould here today to present. Diane Gould is a licensed clinical social worker and also a board-certified behavior analyst. During her long professional career, Ms. Gould has worked for both private agencies and school systems. Ms. Gould has worked for the Northwest Suburban Special Education Organization and the Niles Township District for Special Education. She has served as a consultant and been a guest for many area school districts and agencies. Ms. Gould is a childhood disability and family support specialist for the Jewish Children's Bureau for over a decade. Ms. Gould has expertise in autism. She served as on this professional advisory board of the Autism Society of Illinois for many years. She has provided training on autism and related topics to hundreds of teachers and therapists. Currently, Ms. Gould has a full-time private practice divided between Deerfield and Westmont, Illinois. In her practice, she serves children and adults with special needs and their families. As a BCBA, Ms. Gould also provides behavioral assessments and consultation to families and school districts. She also offers the PEERS program, an evidence-based social skills program for teens and young adults. Ms. Gould's education includes certification in applied behavior analysis from Penn State University and a master's degree in social work from the University of Illinois at Chicago in 1987. She has received additional training from the Institute for Applied Behavior Analysis in Los Angeles, California, the Center for Collaborative Problem Solving, Boston, Massachusetts, UCLA for PEERS certification, and the Social Thinking Center in Jose, California. She is a certified grief counselor and has recently been certified in pathological demand avoidance. Diane, I will now turn it over to you.
All right, wonderful. Thank you. I'm so excited that you all are listening to this. You know, it just makes me so happy that there's interest in PDA, and we're hoping to kind of spread the awareness. So that the next slide, please, Katie. So I'm basing what I'm talking about today on a presentation by Laura Kirby, who is my mentor in PDA. And I was certified by that OCN in London. And I think I'm probably the only one in America who's certified in PDA, but by no means does that mean I know the most about PDA. That is not true in America. I think I'm probably just the one who's kind of crazy enough, who thinks they can like pull off a workshop by themselves, which is what I'm doing in March and going to talk a lot about. So I'll talk about Laura Kirby, who's coming in March throughout this webinar, and Hari Thompson, a self-advocate, a brilliant adult with PDA, who's going to come as well. So at the end, I'll talk about them. But this is, you know, based on Laura's presentation. So I'm starting my presentation, my webinar, kind of with a confession. So, you know, about a year ago, a parent told me about PDA. I was curious. I had heard about it a little bit over the years, but hadn't really paid too much attention. But she had a young adult son who had a diagnosis of ASD, but it didn't quite fit. He was really imaginative and social in a specific way. And when she started reaching out to her friends, other mothers, she found a lot of parents saying that the PDA profile matched their child. So I wish I could say like helping more families was really what got me hooked on learning about PDA, but it's not really the truth. That came later, I promise. But when I started researching PDA, I was struck by their behavioral interventions and how clearly they present those interventions in the PDA literature. I got my BCBA decades after being a social worker. So my approach has also been it's always been a little untraditional as a BCBA. One of the things I've thought about as a BCBA is that the burden is really on professionals to find the behavioral approach that works for an individual. It can't be that we have our behavioral approaches and then the individuals have to fit into what we do. It's on us to figure out the interventions that are going to work, and interventions are only interventions if they change the behavior, right? So the PDA folks in the UK and Australia, they seem to share my behavior philosophy. Because I've always struggled that it feels like we often have this package of behavioral approaches with a kind of a simplistic function-based approach, and we put out some positive reinforcement and some punishment and kind of call it a day. But I feel like we really need to get a better understanding of what's beneath the behavior in order to address it. And we work with so many complicated kids. I think you all in the audience, as therapists or educators, the clients are so complicated, but sometimes I think we write pretty simplistic behavior plans. Maybe it's because we wish things were easier. Like, behavior is not easy to change. And we need to have creative approaches, which I find in the PDA literature. I wish, that diagnoses didn't really drive intervention. That's kind of my perfect world. But in the meantime, learning about PDA for families in the UK, have kind of brought new behavioral approaches and changes in the education system that we don't have here. And I think in America, there's a lot we can learn from the PDA community in the UK. I'm hoping to go in the fall and see some of the schools. There's a few PDA schools in London, and like Laura Kirby runs a home-based tutoring program for families. I just think we need more options here. But since this webinar, go back a little bit. Since this webinar has been publicized, I've gotten calls and emails from parents around the country, mostly moms. And, so one of the moms or a couple kind of were talking about that PDA is the loneliest disability, that no one here understands it when they talk about it. One mom just found out accidentally on a trip to England. So all these moms, I've been talking to over the last months are talking about not being understood and being judged by others because of their child's behavior. They're getting feedback like, how can you not get your smart kid to attend school? And they're fighting a system that doesn't even recognize their child's disability. And talking to all these moms, I was struck that these conversations felt familiar to me. And I realized that they're familiar because these are the conversations I had with moms in like the early 1990s about autism, that their children looked like everyone else. So people didn't understand it wasn't just bad behavior. And they were feeling lonely and unsupported. And I think that's kind of the same thing that's happening in PDA right now. So lastly in this introduction, just want to put out there, I know the name stinks. It does. Both the word pathological and the acronym PDA. I know that's not how we use that in America. So I've kind of struggled to think, like, should we change it or not? Because sometimes in England they call it extreme demand avoidance syndrome, which sounds a lot better. But I do think at this point in America, we need to call it PDA because that's what the literature is based on. And families are struggling to make a community here anyhow. And I don't think we should change the name. But when I've spoken about this to Laura Kirby, she said, she doesn't think it's so horrible, the pathological, because what she thinks it's really saying is that the person can't help it. And that is so true. And I'm going to talk more about Laura and Hari when they're talking in March. Okay, so I think one of the problems with autism and PDA here is that there's a lot of kids and adults out there who don't really fit the traditional ASD description, because they're so imaginative or other reasons that we'll talk about in this presentation. And the traditional approaches don't work for many individuals. I always think like we have so many rigid kids and adults that we're trying to help, but a rigid approach to behavior doesn't help a rigid individual. And I think our literature on behavior, it's not as straightforward as the PDA. So as I said, I'm not a huge expert. I want us to learn together about PDA. So again, thanks for attending. So just a little history. So you'll see it's a pretty recent kind of diagnosis, even in the UK. The early work was in the 80s, and kind of the first book was 2011. So it's really just been this decade, really, that people have gotten interested. And now there's a PDA society and parent groups. So Europe's kind of had the same struggles to get started, but they're just farther away, farther ahead, excuse me, than we are. But this is just a tiny bit about the history. So a little bit about the definition. So now in the UK, PDA is considered part of the autism spectrum. And individuals with PDA share a lot of the same challenges and difficulties as people in traditional ASD, or they call it ASC, I've learned in the UK. But what's central for the people with this diagnosis is the way they're driven to avoid demands and expectations. It's an anxiety-based need to be in control. So that's part of this definition. What's interesting too is that people with PDA seem to have better social understanding and communication skills than others on the spectrum, and they're kind of able to use that to their advantage in some ways, and sometimes it's a disadvantage as well. And we'll talk more about that. But it makes it a confusing diagnosis for people. Next slide. So I'm going to go through some characteristics. These are kind of the original characteristics that have gotten revised. So just, if you think about your child or individuals So, the first one is resist and avoids the ordinary demands of life. Things we don't think are a big deal. Brushing your teeth, taking a shower, going to school. Ordinary demands. Often people with this diagnosis appear sociable, but it's kind of surface level. Excessive mood swings and impulsivity. They can kind of go from 0 to 200 in a heartbeat. So it's talked about a lot with people with PDA that they're very comfortable in role play and pretend, sometimes to an extreme extent. It kind of takes over their life sometimes. They start with language delay, but often they catch up pretty well and are very articulate. The obsessive behaviors, they're similar to some people with autism. Often they're focused, though, on other humans, other people, loving them or loathing them. They can be domineering and overbearing, bossy and controlling, which definitely impacts their social relationships. Parents sometimes say, my child is a Jekyll and Hyde personality. It changes so much more quickly. And like a lot of people, they're more comfortable with adults than children, too. Some more characteristics, and similar to other people in the autism spectrum, there's a lot of sensory issues. They might be hypersensitive to other voices, facial expressions of people, but they might absorb other people's emotions. They can be overly familiar with adults and peers and take on the persona of other people, which is a little different. They like kind of everyone to be at the same level. In terms of that imagination, they often might go into an imaginary role in order to make themselves to comply to things that they are having a hard time complying with. The meltdowns, which we'll talk about, are panic attacks. If they're highly anxious, they can be aggressive. They can be very, very extreme. So we'll talk about that as we go on in this webinar too. They can appear unconcerned about their impact on behavior on others. And I find that when people are so anxious, they're just trying to handle their own anxiety, and they can't really think about other people at the time. One thing
Diane, let
that
me for one moment while we just get the captioner back to.
Sure.
Thank you so much. So, captioner, if you could just kind of get back onto the correct slide. Thank you. Go ahead, Diane.
Okay, too. One thing that's interesting and can cause some problems is that often children or young adults with PDA might act very differently in one situation than another. So they might hold it together at school and then act very differently at home. Another characteristic is just that it's very hard, or they're unable to follow routines set by other people. Next slide, please. So I put just, I'm not going to go into it. There is an assessment in the UK for PDA that people can look up. It's pretty short, but people hopefully will find it interesting. So this is just a few clips from Jane Sherwin, and she's an expert in PDA. She's a parent. These are just some quotes from people with PDA. Someone saying, "Push me to comply can result in such a panic that I might lash out or have a meltdown. Not being able to do so many things that I would like to do is as frustrating for me as it is to you. I even find it difficult to engage in things I enjoy if it's been suggested by someone else." And that's really key. And it's like the next one. My anxiety stops me from doing the things I want to do as well as the things I don't want to do. I think that's really important to keep in mind. Hari Thompson, who's coming in March, he talks about freedom when he talks about his PDA. I know he had said once, I think to Laura, that it's like if we were holding a baby in a grocery store and someone came up to us and snatched the baby away. That's how he feels when he's given a demand, that it's someone stealing his freedom away. And I think that might be a helpful way. So I'll talk a couple of minutes about demands, right? So we get the direct demands, the brush your hair, put your shoes on. And then there's more subtle demands, like it's time to leave for school, or even errands, or eating, or a nice thing like watching TV. There's all kinds of demands. But silent demands are interesting to me. One of the things I learned in studying PDA that I hadn't really thought about is that expectations are a demand. So it's expectations from other people and your own expectations. So expectations in itself are demands. So just silent ones, just leaving the house for school, or following the rules of an activity, or responding to a question can be a demand. Or those self-imposed ones, people not being able to do even things they want to do. And that sometimes is even speaking or responding. So what's interesting for a lot of people with PDA, they're creative in how they try to avoid the demands. They use all kinds of social manipulation, which is hard for people with traditional autism. They might make excuses, or do distraction, or withdraw into fantasy, or negotiate, or suggest alternatives, all kinds of ways. But these kind of creative approaches is kind of a hallmark of PDA. So just a second about anxiety, right? So PDA is an anxiety-driven need for control. Anxiety is what is behind the demand avoidance. So you all mostly know this, right? Fight, flight, or freeze. That's behind anxiety. Next slide, and the next one, right? So anxiety can take lots of forms. Next, thank you. Like there's all these symptoms, right? Irritability, edginess, aggressive, running away, avoidance. We know this, right? And there's so many different possible triggers for anxiety. But when people are anxious, you know, and everyone's different, which we'll talk about too, but these are just a few things, right? That people need: empathy, control, clear information, and help, not words. Don't tell them, but kind of show them. So the empathy part is really interesting, and since I've kind of been hearing a lot from Hari Thompson, who has this huge YouTube following and a YouTube channel, which I think everyone should listen to. If you're interested in PDA, one of the things I learned for him, and I have a big sticky note on my desk in my office that says understanding, not strategies. So he talks a lot about that empathy piece. And I think a lot of professionals kind of need that reminder, because we want to help, so we're so big on strategies. So remember that empathy piece. So people sometimes, when I've talked a little bit about PDA, are thinking, well, it doesn't really sound like autism, but PDA is recognized as being an autism spectrum disorder in many countries. And there's a lot of shared characteristics, right? The social, sensory, interpersonal relationships, that anxiety and the emotional regulation, these are all things that we know that people on the autism spectrum struggle with. But I also want to note, which is important, I think, in a webinar or any talk like this, you know, I know I'm talking a lot about like they and lumping people with PDA into one box. But a reminder, and we know that no two people are the same, that everyone is unique. But for the purpose of explaining a label such as PDA, I'm kind of lumping people into one category, even though there are certainly differences and exceptions. So I find this interesting about how individuals with PDA are different. We talked the last slide a little bit about how they're similar, but people with PDA, again generalizing, have better eye contact than individuals with autism. So they also can learn to mask or fake it, so they can socialize better, especially in small familiar groups, than a lot of people with autism. They dislike routine and they like spontaneity, where most our behavioral approaches and our educational approaches for people with autism are based on predictability and routine. People with PDA do not respond well to behavior plans and reward systems and consequences. Rewards build anxiety for many, many people. Conversation skills can be better. That being very imaginative is also part of the PDA profile. It's different than traditional kind of autism. The demand avoidance, right? Even though some people with autism avoid some demands, the demand avoidance is a huge part of PDA. And also, it's the gender split is different. It's half and half. I think the majority of the moms who I've talked to have daughters, but it's 50-50 too. And we know kind of about autism. So I don't have to go for that other part of the slide. You guys know that. So other people have said that, oh, maybe people with PDA, it's not really PDA. These kids, teens, young adults, they just really have ODD, oppositional defiant disorder. That's the classification that fits. But I don't think that's the case. at all, actually. People with PDA are different. They have the shared characteristics of people on the autism spectrum. They have, the difficulties with social interaction, communication, and a sensory system that gets in the way. The extreme way they avoid demands is different. That hierarchy where children with PDA might consider themselves adults or all want to be on the same kind of level um, of people with as adults. So kids want to be on the same level as their teachers or their parents do. And it's kind of a higher stress level. And then, you all know about ODD. Melissa Neff, who's probably the person who knows the most about PDA in America, she's in Montana. Like she talks about in a lovely way that ODD is more I won't do this, where PDA is I want to do this, but I can't. Right now, I just can't do it. And that I think is a nice way to understand the differences. All right, sorry, now next slide. So how kind of PDA impacts people's lives, right? So just the social behavior, and others might think that they're callous or unemotional. And when demands are suggested by other people, even if the demand will make them happy, they just can't make themselves comply. And they take control of situations, so things are really on their terms. They might be obsessed with other people. They are very anxious, and they don't work well with routines. They just don't, and that's often what we offer to people. So I'm going to talk about strategies for a little bit. So we know, even though sometimes we stick with things and behavior that don't work, but be clear that reward systems are ineffective and they're counterproductive for people with PDA because they're going to increase anxiety. Humor, which can be risky with some people with autism, can be very effective in diffusing situations with people with PDA. Like being spontaneous, putting surprises in instead of having people know kind of what they're working for or what's going to come or if then. Those strategies that we use for other students and people, they're not going to work where the surprise can. That depersonalizing rules, like it's a government rule or it's a school rule versus because it's dangerous, because I say so, those kind of things. Taking the human part out of a rule can sometimes help. As I said earlier, empathy goes a long way, and you never can go wrong when you're being empathetic in my point of view. Using challenges, kinds of, I bet you can't, or I'll race you here, or let's see who can do things first. That kind of those challenges can help as an effective strategy. Letting the children set their rules, have a voice. That can also help. I mean, I know some families have used Ross Greene's collaborative problem-solving approach with success. Probably about 12 years ago, I was trained in Boston by Ross Greene, and some families have been able to, and schools, to kind of look at that, those techniques based on that children do well if they can. So more strategies, choices. There's probably never been a behavior plan I've written that didn't talk about giving people choice. So that's very helpful and really easy to do, giving people choices. So praising indirectly rather than directly, I think that's an important one. Harry Thompson talks a lot about that. What's the problem with praise for him growing up is that people praised for the wrong things. People praised for compliance, not something that was important for him. So also, besides praising for the right things, praising indirectly. So if they overhear you telling someone else how well they did. Reducing pressures is really key. Allowing extra time for things. We'll talk a little bit more about the picking your battles, but that's so important. Just not pressuring the child or individual because there's a time pressure. Indirect demands, which we've talked about and we'll talk about, is just different ways that are to kind of have people be able to follow. So, you can kind of, and it's kind of like that asking for help indirectly too, because a lot of folks with PDA will be able to help if it doesn't feel like a demand. So if you're at home and you kind of say, I need to empty the dishwasher and take out the garbage, and I don't have a lot of time, I wonder what I should do, then maybe that individual with PDA will say, oh, I'll take out the garbage for you. But if you had asked directly for him to take out the garbage, he wouldn't be able to. So a lot of practice people need with giving demands indirectly. You can also use the areas of interest to engage. A lot of people with PDA or on the autism spectrum have their areas of interest. So using that area to engage and to get work done through can help. Having an exit strategy if you're going out with somebody with PDA, just knowing how to kind of get out of an anxiety-producing situation. The check-in and check-out can be really helpful in school, because, and every day is different, right? So you could meet with kind of a student, say, this is what I thought maybe we could do, some options for the morning. Which things do you can do? So giving choices and that check-in. So in all my talks about behavior, I have an iceberg, and so does PDA, right? So there's all these things that go on underneath the surface. Behavior is what we see, but we want to keep in mind there's so many things underneath the behavior, and this slide's just a reminder. So this slide I kept in because I think the journey for everyone in life is kind of figuring out their own behavior and what works for them and what doesn't work for them. And this is just a nice little form in that journey of understanding that people can use. I think a lot of people wonder, kind of with children with PDA, what they're going to need as an adult. And a lot is that self-understanding, to know how they feel and what their triggers are and what helps and what makes it worse. So at the right time, never doing this when someone's upset, but at the right time and the right situation, working on the self-understanding. Also from Jane Sherwin, just a few kind of do's and don'ts that I think are quick and helpful to keep in mind. So don't speak down to me and patronize me. Don't give me direct demands. Ultimatums always backfire. Not stating the obvious, not bombarding someone with questions or insisting that they respond to you. And I think, even well-meaning parents and professionals sometimes have done that. We ask too many questions, and we want a response. It feels badly when people don't. And then in the do's is really about having a relationship with someone. A lot of parents feel the pressure to kind of add on demands with their child, generally the pressure from professionals, where, sometimes I say, oh, just enjoy your child and do nice things. And that's the most important, is that relationship part and that empathy part. Offering choices, speaking as an equal, and really try to understand. And when you see someone's anxious, to pull back instead of go forward. Sometimes I feel like our behavioral approaches kind of, when someone is feeling anxious, we go towards them and actually make the behavior worse. And it always makes me sad when I see behavior interventions that make behavior worse. So just, kind of a quick slide on meltdowns, crisis, panic attacks, what they look like. And the thing with PDA is just how extreme the meltdowns are. And what I like always is looking at these as crises and panic attacks, not as behavior problems or challenging behavior. I think when we look at behavior as panic attacks, it makes us feel much more empathetic to the person. And when we look at things as challenging behavior, often it takes away that empathy, which is so important. And then just a quick slide of how you deal with a panic attack. Just a nice reminder too, kind of not negotiating, not shouting, don't threaten or sanction, and don't take it personally because this is really hard, but being calm and using empathy and keeping yourself safe, and you using distraction and being flexible and humor too. Just like a quick little reminder too. And then, we always want to understand behavior, right? This is just a quick little slide. I'm really figuring out what went wrong, what happened. And it's usually not just a really quick, simple antecedent that one thing happened and that triggered behavior. Often it's kind of how things build up and a confluence of things that happen. But really look what happened and how was it's dealt with, and was it effective, and should you as a professional or parent change how you intervene next time, because it's really on us to support the person who's struggling. So this slide is really what sold me on PDA. Is I think it takes that picking your battles to a different level. It's looking at kind of where someone is in their window of tolerance and how high their anxiety is, and then kind of matching that to the importance of the demand, because those two things have to be looked at together to really figure out what you're going to ask of someone and what you're going to put off to another day, another time. And there's really nice in the PDA literature kind of charts on how to prioritize and give numbers to what you really want this individual to comply with and what you can really put off to another time. I think it's a very helpful slide. So education. So some people have said, that PDA is really an educational disability in some ways. It's not a learning disability. It's a problem with education, because our education system doesn't work for people with PDA. And that's often kind of what makes families feel probably the worst, is that they can't get their child to school, or school's not working for their child, and it makes it all kind of public. I heard that, I don't know if it's research-based, but kind of 70 to 80% of people diagnosed with PDA do not attend school regularly. School, for all these reasons, can be a very hard place. So you can imagine, right? So, just the social part, all the demands from teachers, that hierarchy you're supposed to follow. There's so many rules and lots of kind of behavior plans and disciplinary codes. So there's so many reasons that school is hard. But reminding you again that there are people with PDA, kids who hold it together at school all day, but then really fall apart at home. And often because of this, they can't get support at school, because the teachers and administrators are saying, well, this child doesn't need 504 or an IEP. We don't see anything, but it's the demands at school that are driving the problems at home. And it also leads educators and professionals to be more judgmental with the family, thinking it's a home issue, it's a parenting issue, because they're not seeing it at school. I think in school, we need to do a better job of looking at a child's whole day and not just ending in how we look at things at 3 or 3:30. But that is something that happens for kids. So all these barriers, right? We talk, you can imagine at school, just having to take tests and doing homework, all the social issues, getting in trouble. Those things lead kids not to go to school. I don't like the term school refusal. I think it sounds so kind of purposeful and punitive. I mean, these kids aren't going to school because they can't handle it, and we want to avoid things that we can't handle that are too much for us. But often attendance is a huge issue. So this makes sense, right? Just choices as a in an education system, kind of working collaboratively with the student, sharing kind of assignments, like shared goals is something that Hari Thompson said really worked, but making school collaborative and not authoritarian. So lastly, why I'm kind of so excited about this is I'm bringing Laura Kirby and Hari Thompson to Chicago in March, and they're going to do a much better job than I am talking about PDA. And we're doing it in 2 settings, the same talk Thursday on the next slide, at UIC for people in the city, and then Friday in Skokie at a hotel for people in the suburbs, or for people who, Fridays are an easier day to get away. So it's 2 opportunities for training. I'm setting this up through Eventbrite because I thought that was easiest, but anyone who doesn't want to use Eventbrite can just email me and you can buy tickets a different way. Laura and Hari are so excited to be like bringing PDA to America because they know there's families who want this help, and it should be really wonderful. So please help spread the word about the workshop in March, and hopefully it won't be snowing in Chicago in March. So I put just a few resources in the presentation. Of course, none are from America. That book, My Daughter's Not Naughty, is really good, and the Phil Christie book, you can, next slide, is just a great overall book to start with. It's just kind of an understanding of PDA, and it works for families, professionals, or teachers. If you're gonna, it's a great resource to have. So I put the picture there so people can recognize it. And then Hari's book, right? So he is brilliant and funny. Next slide. And his book is The PDA Paradox. So it's his memoir, life story. It's very nice to read. And then you can also look at his YouTube videos and learn more about him. So that's kind of the end of my presentation. I want to thank you all so much, and feel free to contact me. I'm going to try to answer your questions. If I don't know the answer, Laura and Hari for sure will.
Thank you so much, Diane. That was great information. Can you hear me?
My pleasure. I can. Okay, my pleasure.
So I welcome everyone to put questions that you have in the chat box, and I will read them to Diane. So the first question we have is, as a parent, how can I get help for my child when doctors, even highly popular ones in big cities, don't know what it is or recognize it, as well as suggesting interventions that are in adding pressure and demands that don't work?
I know, that's a great question, and it's so hard, and that's part of the reason, like I decided to do this workshop in March, is just spreading that awareness, because I think if we can reach professionals, that's going to help families. And I know that I'm willing to talk to professionals. I think Melissa Neff, too, in America, because sometimes, unfortunately, doctors and other professionals will listen better to a professional. I think handing them the book, or books about PDA, I think, maybe it's an easier sell to talk about the strategies, and even though we want the PDA awareness, sometimes I think professionals, doctors, can get hung up on it's not in the DSM. So I think maybe focusing on the strategies, that what works. I also tell families too to try to find some professional, either school or in the community, like someone with an open mind who's willing to learn about PDA and to partner with you. Because then if you can kind of go in with a small team at least, it might strengthen you being listened to. But I know it's so disheartening and frustrating.
Thanks for answering that question, Diane. Another question is, what is the incidence of PDA in the UK?
Well, I kept emailing Laura Kirby saying, I know someone's going to ask what the number and the percentage, all that are. And they kind of asked around, and it is too new even there. They don't really have an answer, unfortunately, to that. Because I've been wondering too. I think it's so hard because, it's people don't always even recognize it in the UK. They're so much farther ahead, but there's families there who are still struggling to find doctors and psychiatrists who believe it, because it's not in the DSM-5.
Great, thanks for explaining that. So another question, we're getting a lot of questions in.
Great.
Wonderful.
That makes me happy.
How does a comorbid condition like intellectual disability or emotional disability change the strategies that could be used for PDA? And also, is there an effective way to determine a student with autism also has PDA if they have limited verbal abilities?
I think that's a good question too. I mean, I think there is a wide range of people in the UK, because I've asked kind of a wide range of intellectual levels. So they believe that, or emotional level differences, that the strategy should be tried kind of without, and seeing if they'll work. I think they all can be adapted for different populations. I think, the nice part of what I think about the behavior world is that we want to base our behavioral decisions on what works. So I think using the strategies in a planned way, knowing what we're doing, and using the PDA strategies in enough time to see if they're impacting the behavior, that's really going to tell you. But I think since so much of the PDA success depends on the adult, the teacher, the therapist, the parents' kind of strategies, there's kind of less language that's needed from the individual, and kind of less less that we need them to change for. It's more that we have to change. So I think it would work with that population.
Got it. And I'll just read a comment that came. It was, I think, in response to the very first question. Somebody shared finding professionals who specialize in Ross Green's CPS method, as well as child-led play therapy, DIR floor time, can be more helpful. They be more open to empathizing with PDA and meeting the child where they are at developmentally.
Right, Because that's what it's all about, right? It's for professionals not to be rigid, and people who like Ross Green or like play therapy or floor time. I mean, it's people who kind of are open to meeting the child, as this listener said, and just trying different things and getting away from that top-down approach where we just kind of, you know, tell an individual what we want them to do and just look at behavior on the tip of the iceberg and not really looking at all those things underneath.
Yeah, great. Somebody else says, I understand that this is a more recent identified condition. What work is going on for adults who may have this condition?
I think that's really helpful. I think Hari Thompson is doing a lot of work on reaching out to those adults. I think that even from reading the comments kind of on his YouTube channel, there's a lot of relief I see in the comments for listeners who are adults who are like, wow, that fits me. I think I have PDA. And I think it's that self-awareness. And unfortunately, it takes someone, they have to be able to advocate for themselves, which I know is so hard for so many people. But even if they can advocate with, someone that can help them, a friend or relative or parent, to kind of push the way. You can't change kind of the past, but you can kind of change the present and the future in terms of that self-awareness and knowing what you need. And hopefully this is going to help adults as well who wonder kind of where those struggles came from.
Great. Another question is more geared towards the family members and the supporters. What about supports for the people that live with a person who has PDA? It can be exhausting, this person's face.
Absolutely. Right. There needs to be, and as hopefully as PDA kind of awareness increases, people will have more supports for the family members, the parents and the siblings. I think folks that have already gotten a diagnosis of ASD can, autism spectrum disorders can sometimes access those supports, even if it's not like a pure fit. I know families have benefited, even if they're kind of still banging their head against the wall talking about PDA, they've been able to get some support with autism, but that is certainly not for all families. And again, I think it's just like talking to people until you find someone who kind of gets it and is willing to listen and help, because there needs to be a huge host of support. The moms who I've talked to over America are brilliant and articulate and caring, and they have worked so hard with their child. They've been so creative, and they've done this kind of feeling alone and not getting professional support. They're just incredible. And there needs to be so many more supports out there. Absolutely.
And could I also chime in and provide a question for a resource? Two that come to mind for me. One is respite, and families tapping into respite if they have it available. That's something
right, if they have a different diagnosis than PDA, yes.
So PDA doesn't qualify people for respite, is that correct?
Oh, no, because PDA doesn't really exist in America, right? Okay. I mean, respite's hard to get even with an autism diagnosis from the families I work with. Often you have to have your own respite worker. And these individuals are challenging. So I think people have tried many babysitters or respite workers who don't come back the next day because it's confusing and it's really challenging. But I think everyone should try to exhaust the services that are out there.
Right. And then I'll also suggest the Sibling Leadership Network is an organization that provides information and support to siblings, brother or sister with a disability, and that could be a resource for some of the siblings.
Yeah, and I think that network is less rigid I probably won't, care as much about diagnosis, but
Yeah.
absolutely, just with sibling groups, because I ran them for many years early on in my career. I think a lot of times families have to do the work to get local sibling groups kind of started for their children, often schools or community. I like sibling groups that are weekly, that aren't just once a month. But siblings of individuals with PDA definitely need support, and to know they're not the only person who lives in this situation, because often they cannot bring friends over and their parents' attention is spent on their sibling with PDA. But absolutely.
Yeah. Another question that came in is, do kids with PDA typically have executive function difficulties?
Yes, yeah. I think, again, not stereotyping, but yes, I believe so. I think Laura and Hari know more, but I think there's so much that goes wrong with tasks in school. It's hard to kind of tease out, I think, kind of how much is the executive functioning difficulty, and kind of how much are all these other challenges.
Great.
That's definitely something to, because that's even new, right, for us, really looking at executive functioning as something that's underneath behavior for so many students. I know that's what's getting in the way. So I think more attention overall to executive functioning is really important.
Great. So we are about out of time, and we have a number of questions that I have still not been able to read off. So I want to encourage people that have questions that have not been answered to feel free to contact Diane directly about your question. This webinar has been recorded and will be archived in about a week. It will be on our website, the same link that you used to register for the webinar. And so you can feel free to access it and share it with people you know that you think it will be useful for. I want to thank you again, Diane, for all of this rich information. It was such useful information, and I'm excited about the March events coming up and encourage people to check them out. And I want to also let people know that our next webinar is going to be held on January 8th from noon to 1 Central Time. And it will be about gross motor development in children with ASD and developmental coordination disorder. Thank you again, everyone, for participating, and to you, Diane, for presenting. Take care.
So my pleasure. Thank you.